In our last tutorial, we looked at event editing and how to check through all events in a recording and add some good examples of these into the patient report. Next, we're going to look at the final step in our journey, the patient report itself. The final report shows the results of our analysis. It's provided to the doctor to diagnose and treat the patient. Before we begin, let's do a quick recap on how we arrived at the report stage. The recording was taken from our patient and automatically passed through Pathfinder's algorithm. We then cleaned it up for any noise, checked the beat classifications in full disclosure and more quickly in morphology, and then ran through all events in the event editor and multi-event tool and added some good examples of our patient's events into our report. Now we can preview the whole report to check that the contents tell a realistic and accurate story of our Holter recording. The report will be displayed in PDF format. Firstly, if you'd like to add a summary of your findings or add any notes to the final report, you can click on the Report Summary button and type your comments in the white text box at the bottom. These will be added to the report in the Findings section on page 1. To preview the report, you go to the menu at the top and select Report and Preview Report. It takes just a few seconds to generate the PDF. The report is going to give a summary of what the analysis found. The top of the report shows the patient information. Then we see beat counts, the total number of heartbeats in the recording, and how many were normal, ventricular, supraventricular, and paced. And then information on heart rates and arrhythmias. We can set it on 2 pages by clicking here. There are trends daily, then hourly. We can page up and down by clicking here. Then you have some nice graphical information on heart rates, heart rate histograms, event trends, arrhythmia histograms. And then you see your event strips. These are the 8-second strips which you told the system to print in the event editing and multi-event stages. Remember our pause and dropped beat? We can show morphology. If we had a pacemaker, then all of the paced beats would be shown here in these graphs. And finally, we have our parameter settings, which show the thresholds used by Pathfinder for each event type. If you feel the report is showing anything which doesn't need to be there, then you can click on this button here and uncheck or check the boxes for the content you wish to show in the report, and it will regenerate. Once you've checked through your report and you're happy it tells an accurate story of the patient's recording, you have a Save button up here. You'll see that it saves the PDF directly into Sentinel and stores it with that patient's record. At this point, if you choose, you can print the report out to your default printer. In Sentinel, the report can be viewed and confirmed by any user with the correct permissions via any PC in the hospital with a web browser. Sentinel can even link up with the electronic patient record and save the PDF there if that's available. Now, you can exit the Pathfinder software. Remember to save the changes you made to the analysis as you leave. This is particularly important if you need to quit your analysis halfway through, as you can pick up later where you left off. If you're short on disk space, you can archive and back up recordings according to your site's IT policy. That's it. You've finished your analysis and saved the report, which can now help to diagnose your patient. This concludes the tour of Pathfinder series. Feel free to look back through, pause, and practice with the Pathfinder software if you have a copy. Keep an eye out for Pathfinder videos on more advanced subjects as the video library increases. Bye for now.